If you're over 60 and experiencing burning feet, numb toes, electric shock sensations, tingling, or problems with balance, these symptoms aren't just a strange or inevitable part of getting older. They stem from a biological environment in your body that has gradually shifted over many years. Most people are told that peripheral neuropathy means nerves simply wear out with age, like an old piece of equipment slowly running down. Some hear it's genetic, and there's little that can be done. Often the message, direct or implied, is that the best option is to manage the pain and prepare for steady worsening. What frequently goes unexplained is that nerves don't deteriorate randomly. They respond to the chemical conditions, blood supply, and daily metabolic signals they receive. When that environment becomes harmful, nerves struggle. When it improves, nerves can often retain more function than expected. Peripheral neuropathy isn't one specific disease. It's a pattern of nerve damage. It describes what occurs when peripheral nerves, the long pathways connecting the brain and spinal cord to the rest of the body, begin to malfunction. These nerves carry signals for sensation, movement, balance, temperature, and pain. Because they are lengthy and energy demanding, they are particularly vulnerable to issues like unstable blood sugar, reduced circulation, inflammation, and nutrient shortfalls. That's why symptoms typically appear first in the feet and hands, the most distant points from the heart, most dependent on tiny blood vessels. An important point is that nerve damage accumulates silently for a long time before symptoms emerge. For years, sometimes decades, nerves endure ongoing but invisible metabolic stress without clear warning signs. During this hidden phase, damage progresses. Proteins in nerve fibers distort, blood vessels stiffen, the protective coating thins, and electrical signals slow or become less precise. The nervous system compensates for a while, masking the early issues. By the time burning, numbness, or instability shows up, the damage is already considerable. This lag explains why neuropathy often feels sudden and unfair, even though it developed gradually. In many cases, a central culprit is a group of compounds known as advanced glycation end products, or AGEs. These form when glucose binds permanently to proteins and fats in the body. The binding isn't benign. It changes the structure and function of those tissues. Once created, AGEs are difficult to remove and accumulate over time. They especially damage tissues that require flexibility, accurate signaling, and strong microcirculation, making peripheral nerves a primary target. To understand why AGEs are so significant, consider the process at a molecular level. Glucose is essential fuel, but it's also chemically reactive. When blood sugar remains elevated for extended periods, glucose collides with proteins more frequently. In certain conditions, this leads to permanent, rigid, sticky crosslinks. It's similar to how sugar caramelizes and hardens when heated. In the body, it occurs slowly and persistently when glucose control is poor. The result is tissue that is less elastic, less functional, and more prone to inflammation. In peripheral nerves, AGEs affect three main areas simultaneously. First, they alter the nerve fibers themselves, disrupting proteins critical for transmitting electrical impulses. Second, they harm the myelin sheath, the insulating fatty layer that allows signals to travel quickly and reliably. Damaged myelin slows, weakens, or distorts those signals. Third, AGEs injure the small blood vessels supplying oxygen and nutrients to nerves. These tiny capillaries are vital for nerve survival. When they stiffen or narrow, nerves become undernourished and weakened. This triple impact accounts for the variety of symptoms: burning pain from irritated hyperactive fibers, numbness from lost signals, tingling from irregular firing, weakness from impaired muscle commands, and balance problems from unreliable sensory feedback to the brain. Symptoms differ in combination and intensity, but the underlying pattern is often consistent. A commonly overlooked detail is that fasting blood sugar provides only a partial picture. Many with neuropathy are told their glucose is normal because fasting levels fall within standard ranges. But fasting captures just the daily low point, not the damaging peaks. The greatest risk for age formation comes after meals, when blood sugar rises and lingers for hours. These repeated post-meal spikes drive nerve damage over time. As we age, the body becomes less efficient at clearing glucose from the blood. Muscle mass declines, insulin sensitivity decreases, and sugar remains elevated longer after eating. This doesn't mean aging directly causes neuropathy. It means aging reduces metabolic resilience. When combined with common modern habits, frequent snacking, late-night eating, and processed foods, it sets the stage for age accumulation. Vitamin B12 plays another crucial role. It supports myelin maintenance, aids DNA synthesis in nerve cells, and helps clear harmful byproducts. B12 absorption often declines with age and is further impaired by medications like acid blockers and metformin. Low B12 removes an important protective layer for nerves, allowing damage to progress rather than being repaired. Standard blood tests can miss functional B12 deficiency. Levels may appear normal, yet still fall short of what nerves require. This discrepancy leaves many vulnerable without realization. By the time symptoms appear, the deficiency may have persisted for years. Dietary ages are another frequently ignored factor. Ages form inside the body, but they also exist in food. High-heat cooking methods, grilling, frying, roasting, browning, generate large amounts of preformed ages. These are absorbed and add to the body's total burden. Even with solid blood sugar control, certain cooking practices accelerate tissue damage. Switching to gentler, lower heat methods can substantially reduce this intake. Once damage begins, inflammation amplifies it. Ages activate immune responses that sustain nerve irritation. This is why symptoms often intensify at night, when circulation slows and inflammation persists. It also explains how neuropathy disrupts sleep, creating a vicious cycle. Poor sleep increases insulin resistance, stress hormones, and subsequent sugar spikes, which generate more ages and inflammation, further harming sleep. Physical movement is one of the most effective ways to interrupt this cycle. Muscles draw glucose from the blood after meals. Even brief walks can significantly lower post-meal sugar levels. This isn't primarily about weight loss or intense exercise, it's about improved metabolic regulation. Consistent activity reduces the raw material for ages and enhances nerve blood flow. Muscle strength also plays a role. Muscle loss impairs glucose uptake. Light resistance exercises preserve muscle, support metabolism, and indirectly safeguard nerves. This benefit is often undervalued because it develops gradually, not immediately. Hydration supports circulation and clears metabolic waste. Dehydration thickens blood, reduces microvessel flow, and concentrates glucose. Many older adults drink less without realizing it, subtly increasing nerve risk. Consistent fluid intake bolsters vessel health with minimal effort. Stress influences neuropathy via hormones. Chronic stress elevates cortisol, which raises blood sugar and promotes insulin resistance. Stress alone doesn't cause neuropathy, but it aggravates the metabolic conditions that damage nerves. Simple stress reduction techniques lighten this burden and improve stability. One of the most harmful misconceptions about neuropathy is that progression is inevitable. This belief discourages action and leads to passive acceptance of decline. While severely damaged nerves may not fully recover, many partially affected ones can stabilize and function better in a more supportive environment. People frequently report reduced pain, improved balance, better sleep, and higher quality of life once new damage slows or halts. The goal isn't perfection, it's protection. Every period of stable blood sugar is time free from chemical assault on nerves. Each improved night of sleep supports repair. Each reduction in inflammation aids signaling. Over time, these small improvements accumulate, just as the earlier losses did. Peripheral neuropathy isn't merely a nerve disorder. It's a metabolic condition that manifests earliest in nerves. Viewing it this way transforms it from an unavoidable destiny to something you can influence. The emphasis shifts from symptom management alone to stabilizing underlying causes. This offers no guarantee of miracles, but something more reliable, meaningful influence over the process. And that influence matters a great deal. When people recognize that peripheral neuropathy arises from prolonged metabolic stress rather than abrupt nerve failure, another realization often follows. The nervous system doesn't operate in isolation. It constantly interacts with other body systems. Blood vessels, muscles, hormones, immunity, and the gut all influence whether nerves remain resilient or deteriorate. This interconnectedness explains why neuropathy rarely appears alone. It typically accompanies fatigue, sleep disturbances, digestive changes, balance difficulties, or mild brain fog. These aren't unrelated. They're different expressions of the same core imbalance. A frequently overlooked contributor is persistently elevated blood sugar after meals that doesn't qualify as diabetes. Many spend years in this gray zone, where glucose surges high and lingers after eating, yet standard tests read normal. During this period, ages build silently. Without a formal diagnosis, people assume nothing serious is being missed. But neuropathy doesn't require a label. It responds to continuous exposure. Nerves react to their surrounding chemistry, not to diagnostic thresholds. Glucose clearance depends heavily on muscle tissue. After meals, insulin signals muscles to absorb and store sugar. When muscle mass declines, this process weakens. Glucose lingers in the blood longer, prolonging glycation. This helps explain why neuropathy risk increases with age, even without weight gain. Even lean, apparently healthy individuals may have lost substantial muscle, particularly without strength training. This muscle-glucose connection also highlights why activity offers strong nerve protection, even without major diet changes. Regular short walks after meals reduce spike height and duration. Over months and years, this translates to fewer ages, lower inflammation, and better circulation. The benefit begins modestly, but grows substantial. It targets the cause more directly than symptom-focused approaches. The vascular system is central as well. Nerves rely on a delicate network of small vessels highly susceptible to glycation and oxidative damage. Ages stiffen vessel walls, reduce nitric oxide, and impair necessary dilation. This causes chronic mild underoxygenation, especially in distant nerves. Feet are affected first not because they're inherently fragile, but because they're farthest from the primary blood supply. This vascular aspect explains why symptoms often worsen in cold weather or at night, when flow naturally decreases. It also accounts for why past smoking elevates risk, vascular damage persists, and compounds metabolic injury. Inflammation threads through the entire process. Ages activate receptors that trigger inflammatory cascades. These increase oxidative stress, impair nerve cell energy production, and worsen insulin resistance. Inflammation both results from damage and fuels more of it. This cycle explains why neuropathy can accelerate after symptoms begin, even without lifestyle changes. Sleep serves as a critical repair period. During deep sleep, inflammation decreases, insulin sensitivity improves, and growth factors support maintenance. Neuropathy that disrupts sleep shortens this recovery window. Over time, poor sleep undermines metabolic control and hastens nerve damage. This bidirectional relationship means even modest sleep improvements can yield significant benefits. Eating late at night is particularly harmful in this context. Food close to bedtime elevates sugar when insulin sensitivity is already lower. This prolongs hyperglycemia and interferes with overnight repair. Shifting the final meal earlier often enhances sleep quickly and gradually alleviates neuropathy symptoms. No new foods or medications required, just timing aligned with natural body rhythms. Gut health also affects nerves. The gut manages nutrient absorption, immune regulation, and inflammation control. Poor digestion or chronic gut irritation can reduce uptake of B vitamins, magnesium, and other essentials. It can also drive systemic inflammation. Gut issues rarely cause neuropathy on their own, but they heighten risk and slow recovery. Supporting gut function improves the overall nerve environment. Emotional factors deserve attention too. Persistent pain, worry, and fear of progression can trigger anxiety or depression. These disrupt sleep, elevate stress hormones, and reduce motivation for self-care. This creates another cycle, psychological yet profoundly physical. Breaking it requires compassion, support, and realistic expectations, not self-criticism. Not all neuropathy is metabolic. Autoimmune conditions, infections, toxins, chemotherapy, and genetic factors can damage nerves as well. Nevertheless, metabolic health influences severity and progression in those cases too, stabilizing blood sugar, reducing inflammation, and supporting circulation benefit nerves regardless of the initial trigger. This makes metabolic strategies foundational. When people make adjustments to stabilize their metabolic environment, improvements often arrive quietly. Pain lessens somewhat. Sleep improves. Balance feels more reliable. Temperature sensation may partially return. These changes can go unnoticed if dramatic reversals are anticipated, but they are meaningful. They indicate slowed damage and better performance in surviving nerves. Track progress over weeks and months, not days. Nerve recovery is gradual. Metabolic shifts take time. Fluctuations are normal. A difficult day doesn't undo progress. Focusing on longer-term trends provides the accurate view and prevents discouragement. In advanced neuropathy, the primary aim is preserving remaining function. Halting further loss dramatically enhances daily life. Reduced pain, better sleep, and greater stability promote independence. These improvements matter greatly, even without complete sensation restoration. Medical care remains essential. Sudden or rapidly worsening symptoms warrant evaluation to exclude other causes. Don't discontinue symptom medications without guidance. Lifestyle measures complement, not replace, professional treatment. Research increasingly views neuropathy differently. What was once considered inevitable aging is now seen as modifiable, shaped by lifestyle, metabolism, and overall health. Complete reversal isn't possible for everyone, but many have greater influence over their course than previously believed. The most important shift is perspective. Neuropathy doesn't simply happen. It develops within a specific internal environment. Alter that environment, and you alter the outcome, not quickly or completely, but meaningfully. Effective long-term management of peripheral neuropathy depends more on consistent small habits than dramatic interventions. Nerves respond to repeated patterns, not occasional perfection. One strong week followed by a prolonged lapse achieves little, but modest positive steps sustained over years can redirect the trajectory of decline. It may feel gradual in a world seeking quick solutions, but it aligns with how nerves actually adapt. Aging introduces natural changes that increase neuropathy likelihood. Insulin sensitivity declines, cellular energy efficiency drops, and low-grade inflammation rises. These occur even in those maintaining good weight and appearance. The changes are slow and easy to miss until symptoms appear. Recognizing this reframes neuropathy as the gradual accumulation of small shifts over decades. Aging also weakens nerve-muscle connections. Motor nerves gradually withdraw from muscle fibers, leaving some underinnervated. Surviving nerves attempt compensation, but there are limits. Over time, movement precision decreases, balance declines, and nerve muscle signaling weakens. This elevates fall risk and reduces activity, accelerating muscle loss and metabolic issues. Foot care grows increasingly vital as neuropathy progresses. Reduced sensation heightens the risk of unnoticed injuries, ulcers, or infections. Daily foot inspections become an essential routine. Proper footwear, skin moisturizing, and monitoring calluses or nail changes help prevent major complications. Many severe neuropathy problems arise not solely from nerve damage, but from avoidable foot issues that go undetected. Chronic pain alters brain processing. Sensory, emotional, and attention regions become hypersensitive. This central sensitization amplifies pain and lowers tolerance. Neuropathy management therefore includes calming the central nervous system. Techniques such as slow breathing, mindfulness, or gentle activity can reduce symptom intensity despite ongoing peripheral damage. Pay attention to key nutrients that support nerves. B12 deficiency can mimic or exacerbate symptoms. Magnesium assists nerve signaling and relaxation. Supplements should involve testing and medical oversight, but identifying reversible deficiencies is worthwhile. Hydration influences blood viscosity and flow. Mild chronic dehydration restricts microcirculation and reduces nerve oxygenation. Thirst perception often diminishes with age, increasing vulnerability. Consistent adequate fluids strengthen circulation. Social connections provide unexpected advantages. Loneliness elevates stress, impairs sleep, and reduces self-care motivation. Maintaining relationships with family, friends, or groups supports emotional well-being and indirectly improves physical outcomes. Activity often feels easier and more consistent with others, adding metabolic benefits. Fear of deterioration can subtly restrict choices. Some avoid movement to prevent pain or falls, but this accelerates decline. Replace fear with informed action. Adapted exercise is safer than inactivity. Nerves benefit from gentle use. Inactivity signals the body that the area is less essential, reducing repair priority. Regular medical appointments for chronic conditions can feel rushed. Arriving with clear notes on symptoms, changes, and questions improves discussions. Advocating for yourself enhances care. It's not confrontation, it's necessary for effective ongoing management. Caregivers need support as well. Witnessing a loved one's persistent discomfort is challenging. Understanding that progress is uneven and ups-downs are normal helps set realistic expectations. Supporting caregivers ultimately benefits the person with neuropathy. Over time, the impact of small constructive choices becomes evident. Those who prioritize metabolic stability, movement, sleep, and emotional health often experience slower progression and fewer complications. Symptoms may persist, but they become more manageable. Life remains active and meaningful rather than restricted. The most powerful concept is this: neuropathy is a condition, not your identity. You are a person with history, relationships, abilities, and aspirations. Holding this perspective prevents the condition from dominating life more than necessary. B vitamin status deserves early focus. Routine monitoring of B12, folate, and B6, particularly after age 50, or with medications like metformin or acid suppressors, can detect deficiencies before nerve health suffers. Early correction, via diet, sublingual forms, or injections when appropriate, reinforces myelin preservation and repair that bolster nerve resilience. Hydration, sleep, and stress management form key preventive foundations. Sufficient daily water keeps blood thin and microcirculation effective. Consistent quality sleep safeguards the nightly repair phase when inflammation decreases and insulin sensitivity improves. Simple stress reduction practices, deep breathing, short walks, time in nature, prevent sustained cortisol increases that drive glucose elevation and insulin resistance. For families, prevention benefits everyone. Many nerve protective habits also lower risks for heart disease, cognitive decline, type 2 diabetes, and other age-related issues. When older family members model earlier meals, regular movement, gentler cooking, and nutrient awareness, younger generations adopt them naturally. Children and grandchildren learn that metabolic health is built daily, not lost later. Conversations about neuropathy can move from frightening warnings, "Don't let this happen," to practical, encouraging guidance, "Here's what I wish I'd started earlier." Sharing simple adjustments, like family walks after dinner or milder cooking methods, makes prevention feel approachable, not intimidating. Screening is important too. Regular monitoring of fasting glucose, HbA1c, and, if feasible, post-meal patterns can identify early metabolic shifts. Even within normal ranges, gradual increases over years can prompt small interventions before permanent damage occurs. Inquiring about B12 and other nerve-supportive nutrients during checkups is another straightforward preventive step. One of the strongest preventive mindsets is curiosity rather than resignation. Instead of assuming nerves just fail with age, those who remain curious about how daily choices affect the body make more protective decisions. They notice how specific foods, late eating, or habits influence energy, sleep, or subtle foot sensations. That awareness drives incremental improvements long before symptoms demand attention. Prevention isn't flawless execution or zero decline. It's accumulating small protective factors year after year, so the downward slope flattens considerably. Someone in their 70s or 80s with only mild occasional tingling, solid balance, and reasonable sensation has typically followed these principles quietly for decades. Not extremes, but steady habits. The information here isn't hidden or overly complex. It draws from decades of research on metabolism, glycation, inflammation, nerve function, and aging. What's often lacking is a clear, practical explanation of how these elements connect, especially for those over 60 experiencing symptoms or supporting loved ones. Peripheral neuropathy doesn't have to be a mysterious or unstoppable verdict. It's a signal, a delayed alert that the internal environment has drifted too far from balance for too long. The encouraging reality is that the same environment permitting damage can usually be gently guided back toward conditions that slow, stabilize, or partially restore function. You don't need to undo decades of change overnight. You simply need to stop contributing to the problem now and continue that tomorrow and beyond. Each hour of balanced blood sugar, each gentle walk, each improved night of sleep, each reduction in inflammation is a small vote for nerve preservation. Over months and years, those votes accumulate. They don't erase all damage, but they rewrite the narrative, from inevitable worsening to managed stability, from resignation to genuine hope, from helplessness to real agency. That shift from nothing can be done to I can influence a great deal is where meaningful change starts.